lateral glide restriction. So I'm taking my fingertips, again, not pokey, not with the tips doing this, but using maybe the pads of my fingertips here, pushing up and in gently. You don't have to push very hard on this one here. And you can also communicate as far as which side feels more tender with your patient. And you're pushing side to side, lateral glide. As you remember, you're seeking that pain. You're looking for the places that are tender. And you're looking for the places that your patient says hurt and feel like they don't want to move. And this one here, I begin to get a little pokier. I'm going to turn my hand upward. And I'm going to, after I contact the skin segment, I'm going to turn my hand upward and get up into that multifidus and that semispinalis. Again, those are the deep layer. So a slight extension of the head helps me to do that. Softens that upper trapezius muscle on the outside, levator scapula. And I'm going to do a massage of the multifidus semispinalis by running my hands up and down along those muscles. Then I can hold them and do a little bit of an active release type of approach where I'll hold them with my finger. This one's a little bit more complicated, but I have to take the head into a shortened position here, hold those muscles, and turn. Change my position with my finger, hold, and turn. All of these things can be experimented with and practiced quite a bit. And again, with communication always throughout the entire process, so to make sure that if you're trying to cure a problem in the lower cervical spine, first you're going to find it by palpation with this, asking your patient and also feeling knots and feeling things that you feel are very opposite from one side to the other. And the second is you're going to try to explore different ideas like hold and rotate, hold and move up and down, pure distraction, which would be axial traction, taking the skull in your hand, with your fingers just below that occipital bone in the back side there, and maybe a gentle pressing of your thumbs here along that zygomatic arch. And you're going to just gently take the head and pull it straight off, right along the plane of the body. Another nice maneuver to take pressure out of that entire spine, but particularly the lower cervical spine.